Good day friends, I am Dr. S.K. Gupta and I am going to talk to you about carcinoma of gallbladder and associated CBD stone. She is a patient around 52 years of age who has come to us for a routine ultrasound examination, and she complains that she is having loss of appetite for last 6 months and she has lost around 10 kgs of weight, and she intermittently develops jaundice with fever, but it improves with some medication. And you can see that this is the gallbladder of this patient, and she says that she has been fasting overnight, and this is the gallbladder, which is shaggy gallbladder, which has GV wall edema, and the neck of the gallbladder cannot be defined properly, and you can see that there is a mass in the gallbladder which is not casting any shadow. So this soft tissue mass in the gallbladder is a suspicious lesion which might be carcinoma of the gallbladder. If I tilt my probe slightly, I find there is another lesion over here and there is one lesion over here. This is showing you the gallbladder in the opposite view, that is the horizontal scan, and you find that the gallbladder mass is there, which is shaggily filling the lumen in the gallbladder, and the gallbladder is still not very highly distended despite the patient being overnight fasting in the gallbladder. And there is a eco-dense shadow which is casting a shadow. What this lesion is, we do not know, whether it is a gallbladder calculus or something different like a gas. We have to really explore, but if I tilt my probe, I find that the shadow persists, and it is a dense lesion which is casting a dense shadow. So it is probably a stone. Let's see where it is. And you can see that this is the portal vein and this is the common bile duct. And common bile duct shows a large stone, and when I measured this stone, it was found to be around 25 millimeters by 15 millimeters in dimension, and the CBD also showed some soft tissue mass. Is the carcinoma extending from the gallbladder to the CBD, and the stone has passed from the gallbladder to the CBD, or a stone has developed in the CBD is yet to be seen. But we scanned this patient on 2 occasions just to rule out there is a gas, and overnight fasting, the gas shadow should have disappeared, but the shadow persisted on the day before the examination and on the next day of the examination. So it is nothing but the large CBD stone along with the soft tissue mass in the CBD. Let's see whether this is really CBD or we are looking at something different. When I put in the color, this is putting the color in the live, and you can see that the portal vein is taking up the color while the CBD is not taking any color and showing a radio opaque filling defect which is casting a strong shadow. So we are dealing with definitely a case of large CBD stone with the soft tissue mass in the CBD and in the gallbladder, and it is CBD stone. I measured the CBD. I found that the CBD is around 10.7 millimeters in dimension, and the normal dimension for the CBD for this age should not be more than 7 millimeters, but here it is nearly 11 millimeters, and same is the portal vein, but the portal vein 11 millimeters could be normal for this age, but the CBD is definitely dilated, and it is because of the stone in the CBD. This is the pancreas, and you can see that the pancreas appears to be bulky, but there is no focal lesion in the pancreas, and the pancreas is around 15 millimeters at the head, at about 12 millimeters at the neck, and about 15 millimeters at the tail. So the pancreatic dimensions are normal, but the pancreas is definitely hyperechoic. The spleen was normal. Because we were suspecting malignancy of the gallbladder, we tried to look for any associated lymph nodes, but we could not locate any lymph nodes at the porta hepatis. So this patient will require a dedicated CT scan of the abdomen to look for the details of the mass in the gallbladder and the CBD, and the stone would be better delineated with a higher modality imaging scan, that is the CT scan. I hope you like our video, and in case you like it, please do not forget to subscribe to our channel and share the video among large number of friends so that large number of people can be benefited. Thank you very much.